today I have got Mr. Paul Rogers with me, and he's going to, we are going to have a brief discussion about the significance of pharmacology in optometry practice. So Paul, can you tell us about your background and what your day-to-day job entails?
Sure. Hi, everybody. My job, I have two jobs, essentially. I'm a practicing optometrist, and I'm an independent prescriber. So I've got additional prescribing rights, and that's working in a community independent practice. And then I also have another role where you may meet me in third year, where I'm a lecturer at the University of Manchester and I'm the lead for a clinic called FIT, so Further Investigative Techniques.
That's great, thank you. So in second year of our optometry course, the students are having to learn about pharmacology of drugs that are used for diagnostic and examination purposes. Can you tell us about the significance of these for their third year clinics, especially as you have highlighted FIT? If you can please let us know about that.
Yeah, of course. So essentially the FIT clinic it's an exclusively a third year clinic, and it could be considered like a referrals clinic. So what we do in FIT is we receive referrals from a variety of different places, and it usually involves the patient being referred when something's been found, possibly say within an eye examination, and we need a bit more of an accurate diagnosis, possibly, and a little bit more of an investigation. And so those patients come along to our clinic, and we take a history. We do any necessary further examinations which are over and above an eye examination, and then we come to some form of a diagnosis and management plan. So for you, when you're the students in the third year clinic, you're going to arrive at the FIT clinic, and one of the first things you'll actually do is you will be asked to do an induction quiz. And that quiz is heavily based around pharmacology, because pharmacology is one of the core units that is required for you to bring that knowledge to the FIT clinic, along with things like instrumentation and your ocular disease knowledge and anatomy and physiology. All those are the real foundations that we're going to develop, but it's very crucial that that knowledge is brought to the FIT clinic in the first place. And once we have you in the FIT clinic, what we're going to aim to do is put all that knowledge together, and that's how we can then start to teach you about how we can diagnose, how we can manage, but the essence is that you must have that very basic knowledge for us to be able to do that and go through those techniques and develop those skills.
Lovely, great, thanks very much. So in their third year, as far as I'm aware, the students are also going to have to go through some core competency exams before they can actually qualify for pre-registration. Can you tell us a bit more about what core competencies are, in case students are not aware of that yet? And what's the, again, use of pharmacology for that exam?
Yeah, of course. So a core competency is an ability to perform a skill, have a certain level of knowledge, and that's something set out by the GOC. So you will do some of these possibly in your second year, and you'll do an awful lot of these in your third year. And the core competencies are something that you have to have achieved at what's called stage 1, which is then the ability, you pass all of those by the end of third year, and then you are able to, once they're completed, move on into your pre-reg. But obviously the essence is you must have those completed, otherwise you can't move into pre-reg. So they're obviously very important. You're going to hear an awful lot about these. In the FIT clinic, we have 3 main core competencies. And those core competencies do include the pharmacology A knowledge that you're going to learn in second year. One of the core competencies, for example, is around diagnostic drugs. So you're going to learn a lot about that within this unit. And you've got to show an ability to safely select and use diagnostic drugs. And that might be in a variety of forms. For example, one of the core competencies we assess you in is in a technique called VOLC, which you may not know about at the minute, but you're going to learn and practice this skill. And part of that is that you are able to dilate a patient. So if you have a patient there, you have to use your pharmacology knowledge to be able to make that decision as to what drug is the right drug to use and safely select that and use it. So it's really important that you've got that pharmacology knowledge to be able to take on that decision about which drug to use, and then use that drug, and then practice the skill and show your ability with that skill.
Fantastic. So thank you very much for telling us about, the things, how they're actually going to use the pharmacology A knowledge throughout their degree until the point that they graduate and qualify for pre-reg.
Yeah.
But at the start of this discussion, you also told us that you had another job where you're actually acting as a practicing optometrist and you are an independent prescriber.
Yep.
So could you I just would like to give the students a taste of, what and how, in which ways they're actually going to use the pharmacology A knowledge. So would you be able to tell us a bit about how significant pharmacology A is in your practice?
Yep.
And also, if you could give us an example to elaborate on that, that would be great.
Yeah, sure. So every day, literally every day, I'm using my pharmacology knowledge. To the point where you forget that you're actually using it. You don't see it as it's just an integral part of your day-to-day job. So for example, I dilate patients all day long. I use local anesthetics regularly. So I'm using these diagnostic drugs, but I have to have that pharmacology knowledge to sort of, as a background and a base to be able to use those. I have to have the knowledge of, say, mechanism of action of a drug, the potential side effects, the contraindications, because that's really important when I've got a patient sat in front of me that I'm making those decisions really safely. And so I have to have all that knowledge and assimilate those decisions, and think on your feet. So it's really important. You asked for an example, so I'll give you a really simple example. If I have a patient in practice who has quite a significant allergy history, so they've got asthma and they've got eczema, and I need to perform a technique such as a technique called Goldman tonometry, where I apply a little contact lens onto the surface of the eye. I need to anesthetize the eye. So I have to select a local anesthetic. Now, there's a range of local anesthetics I could select, but there is one particular anesthetic which is much more suitable for that patient because of their allergy history. And it's really important that I know the mechanism of action of that drug so that I can therefore make that decision and safely apply that drop, and the patient's then not at any risk. And part of that decision has to be that you are able to discuss with your patient why you make those decisions. And that is absolutely crucial. And that's going back to the fundamental principles that the GOC instill, which is putting your patient at the center of your care. And you have to have an honest, a very frank, open discussion as to what that drug is, why you want to use it, and then get their permission, because it must always be done with the patient's permission that you apply a diagnostic drug in that way. So that's where I have to be able to answer the questions that my patient may ask about why I've chosen this particular drug and is it safe to use.
Great. So the students might be wondering how frequently they're actually going to see a patient with allergy in the clinic. So can you give us a sense of how frequently this knowledge might be required, for example?
Very regularly. Allergies, every day, basically every day. It may be in the summer, you maybe get more patients sort of feel that it's something that they might bring up within the discussion or the history and symptoms. But yes, I mean, on a daily basis, it's one of my questions I would always ask a patient is, do they have any allergy problems? So obviously in the summertime, when there's a lot more pollen around and possibly their hay fever's flaring up, it's something that's at the forefront of their mind. So it's something that, yeah, on a very day-to-day basis, I would be having that discussion. So it's relevant, yeah, and it's something I use that knowledge all the time.
Fantastic. I'm sure the students have enjoyed so far the information that you've given to them, and I'm sure it has given them some perspective towards the units as well. So the last question that I would like to ask to you is that obviously over the years you have seen so many students coming through the second year to the third year clinics.
Yeah.
Could you first of all tell us what was the biggest difficulty that you had with the students who struggled in the third year?
Yeah, sure. The first few weeks of the FIT clinic, we very quickly start in going over, and that's refreshing that pharmacology knowledge. And one of the big difficulties is that students historically have always sort of seen that pharmacology knowledge and unit as a very much a standalone thing that's a second year unit. And they don't feel it's something that they need to take through into their third year. But I think what the message I'm trying to get across is you don't only need to take that from second year to third year, you need to take that from third year to pre-reg and pre-reg to practice. It's lifelong learning. This is not one standalone unit. And please don't see the knowledge that you're going to get in this unit as just that. It is something that you will need to retain, you will need to develop. And I possibly am, I like pharmacology, and that's part of why I went on and did further qualifications and became an independent prescriber. So I've got the rights to prescribe a wide range of antibiotics, anti-inflammatories, and I'm possibly somebody who loves pharmacology, but it's absolutely fundamental that you bring this knowledge with you to do the third year clinics, because if you get there and I see blank faces, it's really difficult to try and get you to understand that this is something that we need to have as a prerequisite to be able to get you to then be able to manage your patients effectively. And so if you come along with your pharmacology knowledge at the top of your brain, ready and fresh, then this makes my job so much easier, and we can get into the really gritty bits of how we diagnose, how we manage, and the real exciting stuff that you all sort of want to get involved in.
Fantastic. Great. Any final notes for the students?
Enjoy it. See it as something that is entirely relevant. I think you've got an exciting 4 weeks, and it sounds like it's going to be action-packed. So yeah, I'd say enjoy it, soak it all up, retain it, bring it to FIT, and I'll see you next year.
Fantastic. Thank you very much, Paul.
You're welcome. Thank you.